Hello, my name is Grace Cook. I am the Project Support Coordinator for the Heartland Health Research Alliance, and I'm here today with HHRA's Executive Director, Dr. Charles Benbrook, and Dr. Paul Winchester. Dr. Winchester is the Medical Director of the NICU at Franciscan Health Hospital in Indianapolis, and a Professor of Clinical Pediatrics at Riley Children's Hospital in Indianapolis, Indiana. So Paul is also a co-principal investigator for HHRA's flagship project, the Heartland Study. So Dr. Winchester, thank you so much for being with us today, and you guys can take it away.
Thank you, Grace. Paul, it's always a pleasure to have a chance to visit with you. We want to share some of the reasons we joined the team that published the recent commentary in environmental health that lays out some of the serious systemic problems with the ways that pesticides are regulated in the United States and the way that the EPA strives to understand the risks that they pose to people. So today I want to focus with you, the good Dr. Winchester, on some of the things that you're seeing in your NICU, which is the Neonatal Intensive Care Unit at the Franciscan Health Indianapolis Hospital. I've had the privilege to visit with you, Paul, there several times. So let's start with your sharing briefly some of the problem pregnancies and some of the newborns that really struggle that you see coming through your NICU in the last few years.
So yes, Chuck, we might even go back a ways to see how Chuck and I first met. But basically, we have met, both of us coming through different pathways, but joining at the point of being concerned about whether the use of pesticides is having an impact on the health of children, for instance. And we began our work from the perspective of a bedside doctor, wondering why premature births happen, and as a corollary, why do they mostly happen during the month when the pesticides are highest? Premature birth is one of the main reasons that a person like me is even in business, because babies born prematurely are often needing extensive care. And that's the number one disease that I treat. The other conditions that we treat are birth defects, which, by the way, are the leading cause of infant death. So between premature birth and birth defects, we have the two main problems that lead to death in the first year of life. We found that the birth defect rates also peaked in the month in which mothers were conceiving their child, that happened to coincide with the peak use of pesticides, the peak occurrence of pesticides in the environment. So we were drawn to pesticides just because of that, and then began to ask, do they have more to do with health? And this eventually led us to some other discoveries that are now relevant. For instance, if you take an animal model and expose them to pesticides for just a brief moment at the levels that are currently thought by EPA to be safe and harmless, we find that indeed, as they're born, they look fine. They don't look harmed. But over time, we notice that they develop diseases through their lifespan. And when taken out further, we see that their offspring have diseases and their offspring have diseases. And just to kind of put a cap on the nut here, it turns out that one of the pesticides that we now find in every pregnant mother in Indiana causes obesity in rats over the first, second, and third generation, along with many other conditions, one of which is having abnormal pregnancies that often lead to not only fetal death, but maternal death.
Dr. Winchester, you highlighted the fact that there seems to be a trend among both the patients in your hospital, but also society at large of overweight people. How might exposures to a pregnant woman during her pregnancy, how might that contribute to obesity later in a child's life?
So on the one hand, obesity is probably the single biggest risk factor for conditions that most adults have heard about. High blood pressure is one of those. Diabetes, or what's called the metabolic syndrome, where you have an abnormally high blood sugar. And these conditions, diabetes, obesity, and hypertension, have become epidemic in pregnant mothers. The impact those have on the baby is the second half of your question, I guess, in that it causes the baby to have overgrowth, which is often associated with problems. It delays and undermines maturity, so they often have less mature lungs. It even affects the muscles around their lungs so that they have persistent pulmonary hypertension. And as we look down the road across their lifespan, we now see that they have a slightly higher risk of diabetes and perhaps other conditions.
So Paul, would you say, I know this is a very general question, but kind of at a 30,000 foot level, is it getting harder in Indiana for a woman to have a smooth pregnancy, an uncomplicated delivery, and to give birth to a newborn that
Healthy baby
has all of their, their toes and fingers and their nervous system properly wired? Is it getting harder?
Well, the short answer is yes. And if you just increase the number of pregnant mothers who are obese, you actually cause all of those conditions that I have to treat to become more common. So, for instance, premature birth is more likely, but so are birth defects more likely. Mm-hmm. And so as a mother's health deteriorates across time, we see more and more conditions in the mother that lead to unhealthy babies. But let's also remember that we're one of the few developed countries that has now noticed that mothers dying after pregnancy is now on the rise in this country. So premature birth is on the rise, mother's death is on the rise, and that suggests that something really important is changing that's not good for our health.
The general public hears a lot of mixed messages about factors that impact weight gain and factors that make it difficult to lose weight, about what's causing this troubling epidemic among overweight and obesity in children and teenagers, which is a very worrisome trend. Obviously, some people and some past research points the finger at changes in the food supply from more whole and fresh foods and ample servings of whole grains and fresh fruits and vegetables to the heavily processed diets that are typical for many Americans, where a third of the daily calories come from sugar-sweetened beverages, for example, and a wide variety of processed foods contain significant sugar content. So some research suggests that it's changes in the diet and the quality of the food that Americans eat that's triggering this. But then there's other scientists that say, now, wait a minute, the changes in the prevalence of overweight and obesity and metabolic disease, type 2 diabetes, et cetera, the increase in frequency is far too great in too short of a time to be explained by either true genetic mutations in the human population, and also is too great to be explained by changes in the quality of the food supply. So that points the finger towards an environmental factor. So obviously, you being a doctor in a NICU in the middle of the Heartland, this 13-state area in the United States where 60 to 70% of the surface area of the state of Indiana is planted to corn and soybeans, and 99% of that land is sprayed 2 or 3 or 4 times with herbicides from late March into early July. So that's what we call the herbicide spray season. So how is it that a pregnant woman's exposure, say in April or May, when herbicides are widely being sprayed, they're moving around in the air because they drift, they're possibly in some people's drinking water, short of causing a true genetic mutation where they alter the DNA of the woman and her child, how else can low levels of exposure during pregnancy trigger actually genetically driven changes?
Well, that's you kind of hit on one of the most important things that we hope to try to answer with the HHRA study, the Heartland study, which is something that has been worked out in animals pretty well. And as I said, in animals, we have the advantage of just, giving them a very just controlled dose, and we have a control group that doesn't get any. And what we have found is that a very controlled short burst of chemical exposure in the first trimester in a rat leads to obesity in their offspring. And one of those is the most heavily used herbicide right now in America that causes 50% of the offspring to be obese. But another one of the contaminants that's found now in all pregnant mothers is DDT, which was banned many years ago, but is still present in every pregnant mom. It also causes obesity in the offspring, in the grand offspring. So there's an example of how something that mother gets exposed to can be transmitted across generations and not really become its epidemic for generations. Now we're about 3 generations into the DDT exposed first mothers, our great grandmothers. And what's important about the rat model, I wanted to say that those who have looked at the food we eat and are concerned about processed food and so on as being possibly a cause of obesity, they're not wrong. So there's a lot of food-related causes for obesity. The good news about a rat model is that they don't have access to McDonald's, and they don't have poor parenting. They don't sit by the TV and veg out, and yet they become obese in the same way that our adults are becoming. So yes, all of those things are irrelevant, but I think there's something bigger, as Dr. Benbrook has suggested. Something else is taking us across the globe. It doesn't matter what country you're in, obesity rates are going up. And so there's something that all of us have in common, that even though we have different diets, that's making us more obese.
Well, it certainly is a big challenge for the scientists that are working on the Heartland study to try to sort out all of these different factors that no doubt are contributing to one degree or to another to worrisome trends in the health of mothers, the difficulty of getting pregnant, the difficulty of holding a pregnancy through the full 9 months leading up to a healthy birth. So Paul, I've had the pleasure of visiting you at your house. You live out on the outskirts of Indianapolis. I think you've got a couple cornfields and soybean fields not too far from the back of your property. Have you, in the last 4 or 5 years, noticed any hard to explain symptoms in the trees in your backyard, or your wife's roses or tomatoes in the backyard garden? Have you noticed anything of late?
Yeah, in fact, it's funny that just 2 days ago, my wife asked me why the helicopter kept flying by our house. And I said, well, it's probably that one that commutes, from Columbus to Indianapolis. And she said, no. Later on, she realized that was a helicopter that was spraying the field across the street from our house.
Oh my.
So one of the things we noticed when one of the sprayers went by our neighbor's yard right next to us, which used to be a cornfield, is we were by the pool cleaning it out, and we could the carpenter bumblebees come out in the spring, and they're kind of a fun creature to watch. They tend to patrol their territory, and so they're easy to see. And this big sprayer came by and left so quickly that we barely realized that we were inhaling pesticides. But what really struck us is the 3 bees that were there just dropped out of the sky dead. And the first thing that was remarkable to me is that we have been taught that weed killers are weed killers. We didn't know that they were also bee killers. So that's one of the things we've noticed, is that the bumblebees and the honeybees have disappeared. Even the monarch butterflies have disappeared. But the other thing is, as I've been learning more about Roundup, for instance, has created a whole host of resistant weeds, which is one of Dr. Benbrook's specialties. And I finally looked them up to see which ones they were. And sure enough, my whole backyard is filled with those mare tail resistant plants. So literally all the plants that are or surrounding the house are now the Roundup resistant plants.
So Paul, most people in the Midwest that live kind of on the outskirts of the city and near farm fields, or people that live out in the rural areas that are heavily farmed, the issue around herbicides that they've experienced themselves in their own yards, in the trees in their communities, is damage from the volatilization and drift of dicamba herbicide, and now increasingly 2,4-D herbicide. Both of these herbicides are volatile. The farmer sprays them legally on the soybean field, but then especially when it's hot and humid and there's an inversion, the herbicide volatilizes, moves up in the air, and then moves with the wind, and somewhere downwind comes back down to earth, where they're very potent herbicides. And if they happen to fall on a tomato plant or a cucumber or a soybean field or a cherry tree or an apple tree, when those plants are going through their seed setting or their fruit setting process, basically having their babies, if you think of it in a human analogy, very low levels of these herbicides, they're kind of like birth defect mutants in plants and trees. And so all over the Midwest, people have been reading about conflicts between farmers, the impact of drifting herbicides on iconic trees and in public spaces and in parks. But rarely do we see any discussion of what the levels that are moving with the air and are biologically active enough to impair the reproductive processes in plants. Rarely are people wondering, well, geez, are pregnant women getting exposed to enough to alter their reproductive process? And what's your thinking about that? Is it possible that the plants are just far more susceptible and hence are impacted at a lower level of exposure than what it would take to adversely impact a pregnant woman, or not? What do we know about the differential susceptibility, sort of, microgram for microgram of exposure to a plant and a pregnant woman in terms of the possibility of adverse outcomes?
So we've actually measured one of the most heavily used herbicides in the US, Roundup, in two groups of pregnant women. And that's our way of estimating their exposure. These are all low levels of exposure according to the EPA, but what we then could do is look at how their pregnancy developed. So we measure them in the first part of their pregnancy, and then looked to see how their pregnancy went. And we so far have identified two really important adverse outcomes that get more likely the higher the level in the mother. And these are all levels that are considered safe. But the mothers with the highest levels are the most likely to have a preterm or a shorter pregnancy and a smaller baby, smaller than normal for that age. So those two things, a reduction of fetal growth and a shortening of pregnancy, essentially are two of the most important outcomes of pregnancy there are, and sadly can have long-term effects on the child. And all we know so far is that the measured levels in the mother are the thing that predicts those outcomes.
So Paul, based on the studies that you've conducted yourself and the data that the Heartland study and the Heartland Health Research Alliance has already generated and will soon be publishing on the levels of glyphosate in the urine of people in the Midwest, how big of a difference is there between, say, the most heavily exposed fourth of people compared to the least heavily exposed fourth or quarter of women? How big's the difference from a highly exposed woman to one that's hardly exposed or not exposed at all?
So we're talking about the difference between 0.5 to 1 part per billion, or per million, I should say, and 13 parts per billion. So these are not high numbers relative to what they could be. And they're not as high as some of the numbers that have been found in people who apply pesticides, farmers, and sometimes children, who work with their dad spreading. So these are kind of what's striking. What surprised us was to find that every mother has some level. Almost all but one mother in one of our series had a detectable level. And that means that it's not just being next to the farm that they're getting exposed to. It's also in their food.
Yeah. So Paul, based on the data that you just shared in terms of the high levels being 10, 13 milligrams per kilogram in a woman down to less than 1. So there's at least a 10-fold difference between the more highly exposed people and the least exposed people. So that's a sort of I think a common rule of thumb that there's that kind of differences just based on where a person lives, what kind of food they choose to eat, whether they're using any pesticides around their home. But then, Paul, isn't it also true that we now know that there are some significant differences within the human population in how people metabolize pesticides that they're exposed to, how people respond to them, the effectiveness of a person's immune system to counteract the impacts of pesticides that are ingested. And so we also know that there's a significant range in vulnerability, if you will, within the human population. So really what we're trying to sort out through the Heartland study is, the pregnant women that perhaps fall in the high vulnerability group or the high exposure group, or even both, how do how do their birth outcomes differ from women that don't appear to have any genetic or a medical history factors that are correlated with adverse birth outcomes, and also women that don't have much herbicide in their urine, and indicating that they're not being heavily exposed. So that's what we're trying to tease out. And so what, Paul, I'm sure we've both had this experience when we tell people we're hoping over the next 4 or 5 years to enroll 2,000 pregnant women into the Heartland study and bring them through our full scientific protocol that actually goes all the way through when the children grow up, and we can fully diagnose their behavioral abilities, their behavior and their intellectual abilities. There's this significant set of differences and many factors that might be coming into play. So doesn't it take a lot of women to sort all those possibly confounding factors out? And that's why we're trying to do such a large and unfortunately expensive study.
Yeah, first of all, yes, vulnerability is a huge factor. And we know about some of those vulnerabilities. There are some pesticides that are related, called organophosphate pesticides. They're fairly heavily used. And we've identified specific enzymes that allow us to metabolize those and either make them basically non-toxic. And we've identified certain individuals who have a gene defect in their peroxidase enzyme that metabolizes, and those mothers that have that polymorphism in their gene can't protect their fetus in the same way that regular mothers can.
Right.
And we have found that their babies have smaller brains. It's affecting the speed of growth of their brain. Now that's a huge adverse outcome, because it also means that their children's cognitive development later on will be less than it could have been.
Yeah.
So that's just one example of how a specific enzyme can help us. We're actually, our body's designed to detoxify our environment, and so clearly some of the women that we're measuring have specific defects in how they metabolize.
So Paul, one of the points made in the paper that you and I served among the 9 co-authors on, that was published in Environmental Health, one of the points that we try to make as clearly and forcefully as possible is that the science that EPA calls upon in regulating pesticides, most of it was designed back in the 1980s and based on what was understood at the time as the primary mechanisms through which exposure to pesticides might lead to cancer, or might lead to reproductive problems, or renal disease, or other adverse impacts. But in recent years, we've learned that some pesticides, and including this major herbicide you've spoken of, glyphosate, the active ingredient in Roundup, actually also impacts the health of the microbiome, which is the family of microorganisms in the human GI tract that not only does it, of course, do the daily work of breaking down our food and extracting the nutrients our bodies need from food, but the gut, the GI tract, also plays a huge role in our immune response, in the ability of our bodies to deal with, fight off either viruses or bacteria or other pathogens or chemicals that come into our bodies through beverages we drink, drinking water, or food. So now it looks like scientists are going to have to understand how pesticide exposures are impacting the microbiome in real time in order to fully understand how day-to-day dietary exposures to pesticides might be undermining an individual's health. Could you imagine 5 years ago that we'd be having this conversation?
No, it's an example of the many ways and mechanisms that we didn't even know existed, that in which chemicals can harm us. But to just amplify what you just said, we have now evidence that a pregnant mother's exposure to pesticides changes her microbiome. And that change alters the development of her fetal brain, of the baby's brain, in an adverse way. We now have evidence that the friendly bacteria that we're supposed to have in our guts, when those are replaced by pesticides to unfriendly ones, they produce toxins which in fact migrate to the point of altering the brain development of our fetuses. And if you don't intervene in pregnancy, you can't alter the outcome of the fetal adverse effects. So there's even a greater need for us to understand this even in the moment of pregnancy, that these changes in her bacterial microbiome are possibly causing adverse effects.
Mm-hmm. So Paul, one last question before we close. I know that you routinely attend a number of meetings of OBGYN, pediatricians, other clinicians, doctors, and scientists that are devoting their lives to helping women have healthy pregnancies and raise healthy babies. So you get to rub shoulders with the people doing the same sort of medical work that you're doing there in Indianapolis. I wanted to ask you, sort of when you run into a colleague that maybe you went to medical school with, that's doing the same thing you're doing at a hospital in Little Rock, Arkansas, or in Columbus, Ohio, are other scientists and clinicians like you, are they thinking about and trying to find answers to these questions, or are they kind of below the radar screen?
I'm kind of sorry to say that physicians don't have the same freedom to act or to recommend or to give therapies. We noticed this with COVID. You think how long it takes before you're allowed to give a medicine to a human. So a lot of this work is done for decades in animals before it's ever brought to the level of therapy for doctors. And so doctors, many of them who aren't interested, aren't doing research, they're doing clinical care, aren't left with very many tools. But I will tell you that those in my generation who went to medical school had never heard of the epigenetics or the microbiome and many of these other adverse outcomes. So when Chuck and I speak around the country, a lot of my physician friends are hearing it for the first time. At the same time, we are having mothers asking us, I'm pregnant, should I use organic food or not? And we do have evidence that organic food reduces the pesticide load. We don't have evidence that it makes you healthier, but it's a start, isn't it? To know that you can reduce how many pesticides your fetus gets if you go to organic food. Now that's just a crude first step, but sadly we are dependent on the studies that we're trying to do before we can get the answers that are needed.
Well, Paul, thank you very much, and also, on behalf of all the young mothers and families in Indiana that are hoping to have a healthy child, thank you for your work over the many years, and we'll keep digging and looking for answers. Thank you.
Thank you for helping us get those answers.
Yeah.